everybody. So today is the second video of the three-part series on trauma and other related topics. Last week I talked about trauma and PTSD. This week I'm talking about dissociation, and next week I'll tell you some more about EMDR, eye movement desensitization and reprocessing. So on to dissociation, and its simplest form. Dissociation is a mind-body disconnect, and this is the motion that I do in session with clients quite often. A more formal definition is dissociation is a mental process that causes a lack of connection in a person's thoughts, memories, and sense of identity. We all mildly dissociate. If you ever notice yourself daydreaming or getting lost in a book or going into autopilot, one of the examples that I use is, if you're driving home and you get home, particularly from places that you visit pretty often, like work, and you get home and you think back and you can't really remember a whole lot about the drive, very likely that you mildly dissociated. Their dissociation exists on a spectrum, so mild dissociation at one end, and then everything in between until you get to severe dissociation. If it is so severe, you could actually have dissociative identity disorder, which used to be known as multiple personality disorder. We don't use that diagnosis anymore. Transient and mild dissociative experiences are common. About a third of people say that they occasionally feel as though they're watching themselves in a movie. And those experiences tend to be highest in a person's youth and steadily decline into their 20s. 7% of the population may have suffered from a dissociative disorder at some time, and dissociation is actually a common symptom of trauma. There are 5 different kinds of dissociations. There may be amnesia, which is where someone has difficulty recalling specific incidences or experiences or times in their lives. There's depersonalization, which is where you may feel as if your body is unreal or not your own or changing in some way. This would include out-of-body experiences, which most people report feeling as if they are watching themselves in a movie. Some clients have also told me about times when they've looked in the mirror and didn't really recognize, or something seemed off about their reflection or the person that they saw. There is derealization, which is where the world around you doesn't seem real. Objects may be changing in shape, size, or color, or you may feel as if people are like robots or strangers. There's identity confusion, which is where you feel uncertain about who you are, and there might be some struggle to really define yourself. And then there's identity alteration, which is where there is a shift in your role or your identity, and it changes your behavior to the extent that other people may be able to observe this. I don't actually treat dissociative identity disorder, but I do work with dissociation in my clients. Working with trauma, like I said, it's a common symptom of it. And there are different techniques that I use, but one of the most dominant ones is just grounding skills. So in a previous video, I talked about 5, 4, 3, 2, 1. I'll use that to help people kind of come back to the present moment and to be in the room with me. Blowing bubbles can be an activity that I use with clients. And when I talk about next week in the video on EMDR, I'm going to talk about the window of tolerance, which is where I tend to see most dissociation. So if you have any questions or comments, you are welcome to leave it on the video, or if you feel more comfortable shooting a private message, feel free to do that as well. Until next time, guys.